Hello and happy Friday. This is going to be our last daily dose for this week. We're on bell ringer day 11, 5/26/23, and we're going to be talking about consent. So what you need to know about informed consent. Informed consent is a process that's required for most medical procedures. However, there's often confusion about what informed consent is, what it means, and when it is needed. In a healthcare setting, informed consent allows you to participate in your own medical care. It enables you to decide which treatments you do or do not want to receive. Also, informed consent allows you to make decisions with your healthcare provider. This collaborative decision-making process is an ethical and legal obligation of healthcare providers. In this article, we'll help explain what informed consent is and when it's needed, what it should include, and why it's important. And the reason I left that in is so that you guys would know that these are all things that I have researched on the internet in Mr. Google. Remember, we talked about that soft skill research? What is informed consent? Informed consent is when a healthcare provider, like a doctor, nurse, or other healthcare professional, explains a medical treatment to a patient before the patient agrees to it. This type of communication lets the patient ask questions and accept or deny treatment. In a healthcare setting, the process of informed consent includes your ability to make a decision, explanation of information needed to make the decision, your understanding of the medical information, and your voluntary decision to get treatment. These components are essential elements of the shared decision-making process between you and your healthcare provider. Most importantly, it empowers you to make educated and informed decisions about your health and medical care. What types of procedures need informed consent? The following scenarios require informed consent. Most surgeries, blood transfusions, anesthesia, radiation, chemotherapy, some advanced medical tests, like a biopsy, most vaccinations, some blood tests, like HIV testing. So these are just some. This is not all. What should it include? An informed consent agreement should include the following information: diagnosis of your condition, name and purpose of treatment, benefits, risks, and alternative procedures, benefits and risks of each alternative. With this information, you can make an educated choice about the procedures you receive. So, working at a medical institution, you need to understand informed consent. I hope that you learned something in what we discussed today about consent and the types of procedures that need informed consent. And please remember that these are just some, not all are listed. Have a great weekend, and I hope you learned something. Bye-bye.